For those online, thank you for staying this late in the day. Denise Sakuze Skaze, Hadi Sootsen, Bet Onzu, Travis Holyk Sathni, Sabuzi Biskai Sathni. To everyone in the health department, those that are watching online in my department, I just wanted to express my gratitude for everything that you do. I know that it's been challenging times, and so I really do appreciate all of the work that our health team does in the communities to make it a better place. I also wanted to acknowledge the health directors. So we have a great team that I'm really proud of. I'm proud of the work that they do and the tireless hours that they provide. So with me up on the stage are Rhoda Halgren, our Director of Community Health Services, Marilyn Jansen, our Director of Mental Wellness, and Rachel Wells, Director of Quality and Innovation. So, Masai. Throughout the speeches today, there's been a lot of talk about succession planning, and so I also wanted to acknowledge Mabel. So Warner also mentioned that Mabel has not officially retired, that she's still with us. And I just wanted to say thank you to Mabel for always being there for any questions that anyone on the team here still has. It's been a great resource in building the Healing Center. You've been the consummate elder in terms of this is the history of things. This is where ARP was back in the day. And so we really appreciate that corporate knowledge that you're able to share. And I just wanted to publicly acknowledge all the support that you do give us. Today, I wanted to give an overview of some of the things that we'll be focusing on health and some of the things that we have done over the last year, just so you have an idea of where we're going. It's exciting times, both in jurisdiction, but also in health, because we do have things like the new 10-year health agreement. We have the Healing Center. We have Foundry in Burns Lake. And so a lot of work is being put into the strategies that we do provide. Every 10 years, as part of our agreement in health, we do a health transfer evaluation. And so this year it was completed by Dr. Pat Camp. Dr. Pat Camp also does work with us in terms of lung function testing in the communities, a number of lung-related grants. And that's another thing that we're proud of within Carriacou County Family Services is our ability to translate research into direct services at a community level. So this year, with the health transfer evaluation, it was a combination of door-to-door surveys and key informant interviews in each of the communities. Self-reported physical, mental, spiritual, and overall health in the communities. The majority of respondents rated their health as good to excellent, which is good to see. You can also see from this, we're trying to incorporate a more holistic approach into how we're looking at health. Rachel's team with Mary also in terms of indicators. We're doing a lot of work around indicators so that we can track wellness over time. Health concerns that we heard about, these are kind of the main concerns that people talked about that as we develop our health transfer agreement, we will be focusing on. So mental health and addictions, physical inactivity, nutrition and weight, arthritis, pain and injury, and access to health care. And so with each of those will be areas of focus. It's also something in terms of primary care that we're proud that we've been able to improve access to health care, but you will see that as a theme that with our communities, we want to make sure that people have timely access to care. Things that are good for health in the communities that people also wanted us to focus on was cultural connection, CSFS resources and programs, events, physical activity, community connection, food availability and quality. The health center is something that's really important to the community as well and that they're proud of. addiction programs, the community garden, and mental health programs. So those are things that people thought really were important to our communities. I should also say that when I first started presenting at AGAs, my eyes were a lot better. I can barely see that, and I had to go to a 14 font on the few notes that I did provide. So times are changing. In terms of recommendations that came out of the health transfer evaluation, continued addictions treatment and mental health service expansion. That is an area, obviously, that we are working on, and we're proud of the Healing Center. We do have a group that meets on a regular basis to develop that operational plan, and so it's definitely in the forefront of what we're going to do, even from the Healing Center to the services in the community. And so it's great that Marilyn and Christina and Randall and others have the expertise. We're adding additional team members to really fill out a team of experts in the area of treatment and mental health. Explore with member nations the concerns regarding healthcare information confidentiality. So Marlena did touch on privacy. Our MOAS system, we want to make sure that we're leaders in the confidentiality of the information that is in our electronic medical record and that it's kept safe. There's a lot of different ways that that information can be protected, and we do a number of audits to make sure that that information is kept confidential. Formalize a communication plan with CSFS and between CSFS and communities. So Warner talked about this as well, that, well, and I think, Stephen, you touched on this as well. One of the strengths of what CSFS is trying to incorporate now is that there is a separation of services between the political and the health side and the child and family, but we also recognize that it's the chiefs that are our leaders that need to make sure that the vision comes from the communities, and so there's communication that way. And our evaluation also showed that we need to improve communication among teams, that we can't work in silos. Brad touched a lot on creating a human resources recruitment and retention strategy. That came up in this evaluation as well as the health evaluation that we did do. And so I think in these times, Brad touched on that a lot, that we're doing a lot of good things in order to recruit and retain staff, but that will be an area of focus as well. Improve care efficiency, including scheduling, scope of practices, and communications. We're leaders as well in virtual services, and so we've expanded those services to different areas of health, including mental health. Balance growth with opportunities for interaction and engagement. So we talked about throughout the day that CSFS is growing, but it still is the community's organization, and so we need to make sure that we're getting input from the community throughout what we're doing so that we're in balance and harmony with the community. Continue the community-led health priority setting process. So again, that's part of that communication. The other thing that Rhoda and her team has been working hard on is community consultation. So when we talk about making sure that it's the communities that are driving those priorities, we're making sure that in communities, we're meeting with communities so that those priorities that we will take to First Nations Health Authority in terms of our next agreement are aligned with the community. So from that, we will be developing health plans for each of the community and rolling that up into a Kersicani health plan. And that'll enable us to operationalize the services that we do provide. What we have been doing is meeting with leadership as well as health staff. Rhoda has been out to the health fairs collecting information there. And so we think that that's a really important process to make sure that everything that we're doing aligns with community. We'll then create that into a budget that we'll take to FNHA. We're also pushing in terms of with First Nations Health Authority to say those old funding formulas don't work, that we are looking at substantive equality, making sure that the services that people need in the community are aligned with the way that they're funded. themes in community consultation that are coming out, and these look a lot like some of the themes of the health transfer evaluation. So in some ways it is validating some of what we've already done, but we'll continue to do work in community to validate the results. But aftercare, funding to address overdoses, a need for a dietitian, additional nursing and physician services, and a focus on traditional healers. So based on some of that, I also wanted to touch on some of our goals for 2022-23. What we are doing is developing community-specific health plans and negotiating those new health transfer agreements. With that, we hope to increase services that are the services that communities want to see in community. Warner touched on the Healing Center. That's one of our main projects. So we do have the operational plan. And so obviously you can build a healing center, but it has to be effective for those individuals that are going to staff it. And so we've been working really hard with the operational team, the experts in different areas like detox. We've met with detox in Surrey, detox in Vancouver, to make sure that the way that we're doing things meets the best practice standards. And obviously on the healing side, the Healing Center side, Christina has a vast knowledge of the work that's been done nationally and has been part of national surveys. We also, as part of that Healing Center, and also you can see that mental health is one of the main things that people are saying we need to focus on. So we did partner with UBC Okanagan to do a mental health evaluation to make sure that the services that we are providing are based on best practice standards. And so a couple of things that we did was look at different models throughout the world. We also then spoke to community members as well as our staff to look at how we can actually improve services. What we also will be doing is now, with Rachel's team, an evaluation of the addictions recovery program as well. We hope that that then feeds into the plans that we're providing on the Healing Center. Foundry Burns Lake, and another shout out would be to Ellen. So in 2019, it was Ellen on our board that said, hey, I've seen this call for a foundry. This is something that would be vital to Burns Lake as well. So foundry is basically youth services from 12 to 24. It's based on a holistic approach to services, much like Carey-Sicanni Family Services provides, where you have primary care, you have mental health, you have social services, you have peer support, all in one place. And so it was Ellen who said, this aligns really well with what we need, and there's a lack of services in Burns Lake, so CSFS needs to apply for those dollars. Community consultations, next week we'll be meeting with the youth. Our architects will be there to begin designing the building to make sure that it meets the needs of youth in the community. We'll also be having evening sessions and lunch sessions with other stakeholders in the community. All of this is also driven by a leadership committee that has been with us from when we started the proposal. So it's been made up of MCFD, Northern Health, FNHA, CSFS, the school district, all of the leadership in the Burns Lake area. So that includes Village of Burns Lake, as well as the chief and councils of all of the different nations. We've had parents, we've had I think, well, basically everyone in Burns Lake has provided input. And so that's what made our proposal. There was only 8 accepted out of the roughly 40 applications throughout the province of British Columbia. What made our proposal really strong was the level of inclusion and involvement that we have had from the community as a whole, because it represents all children and youth in the Burns Lake area. Another focus that we will have is on UBA Clinic in Prince George. Within our primary care network. Prince George has always been a place where people come because of chronic disease. They may be in Prince George for a specific period of time, and then they'll go back to community. And so we want to focus on services in the Burns Lake area because of that transition to and from community. I mentioned our electronic medical record. Our providers can see people throughout wherever they are, and that information is within one EMR shared, whether you're in Fort Babine or whether you're in Prince George. And so we hope, even when there's pregnant mothers that need to come to Prince George to give birth because there are no deliveries in Burns Lake or Fort St. James, that with a clinic in Prince George, we'll be able to make sure that they get the services that they need, and then with that we can transition them back to community. So there's a lot of work that we will do to make sure that people are accessing care. We've got a beautiful clinic at 970 4th Avenue. We kind of took the adage, if you build it, they will come. Now we're working with the Ministry of Health and others to make sure that it's adequately funded. Right now we do have nurse practitioners as well as some sessions of our docs to service it, but it's clearly not enough. We've kind of worked with other kind of pots of money through proposals. So BC Children's, we have our perinatal clinician, Jen Scott, who provides services. We worked with Mary's team to have a primary care nurse, Janet, that also goes to UBA Clinic, and she focuses on our opioid agonist therapy, making sure that youth have access to health care where and when they need it. So a cool thing about the work that Janet does is that she will see them right in the Skyzaya clinic, where youth might not be comfortable coming to a medical clinic. She can then introduce them to services there. So we're making sure that we're meeting needs wherever people are. And that's it for me. Masai Chos Nachaya.
Thank you, Travis. So are there any questions from the floor or online for Travis? I don't see any, none online, no on. Oh, there's a question.
Nice try, Benna. But Biscay means seagull. But I'm not going to share the story behind how I got the name.
I guess we'll have to go to Wilf or Benna for that story. All right, thank you so much to Travis Holyk, Executive Director of Health, and his director team. Thank you so much.